So yes, today's session is High Yield Anatomy MCQ session 4. So we are targeting the 4th session of the Anatomy MCQ session. Myself, Dr. Monalisa. So let's start with the session now. Okay. So I have got 8 years of teaching experience for the various competitive exam in the medical field. And those who want to be the part of free sessions on the Unacademy platform, they can use my code ANAT10 for unlocking free sessions. Okay, so this is my unlock code, that is ANAT10, which can be used by you. Also, I want you to tell that if you want to know my session plans, so generally YouTube session of MCQ sessions is conducted at the timing of 7:30 p.m. And morning 11:30 a.m. is a conceptual anatomy topic. So those students tell me that please ma'am continue these topics and we want to study in more conceptual way. So that is conceptual topic wise, and so let's start the session now. So I think the screen is clear. Yeah. So these are the details of my upcoming session. Okay, these are the details of my upcoming session. So these are the sessions which I take on the platform of Unacademy. So you can join me for that session. Okay. So yes. So I think we should start with the MCQ session now, and today also I have targeted 10 MCQ sessions. So we will have 10 MCQ discussions. So every day 7:30 p.m. is the time dedicated for the MCQ session. Okay, this is the referral code ANAT10. This can be used for seeing the free sessions on the Unacademy platform and also for taking the subscription of Unacademy. Okay, so let's start with the session. Let's start with the first MCQ of today's session. Okay. So let's start with the first MCQ. Question number 1. In subclavian artery block at the upper border of the first rib, all of the following arteries help in maintaining circulation to the upper limb except. So 4 options are there. There is thyrocervical trunk is the A option. B is we are got suprascapular, the subscapular and superior thoracic. So accordingly 4 options are there. So whichever you think is the right, please mark it correct. So I will wait for 30 seconds, otherwise I will come up with the explanation of this MCQ. Okay. A, B, C and D, whichever is right, you can mark the correct answer. Okay. So actually the correct answer for this MCQ, so if you are not knowing also you can mark, nothing to worry. So the correct answer, which is not maintaining the blood flow for the upper limb in case of subclavian artery block, the correct answer is D. So why the answer is D? Superior thoracic artery is the correct answer. The reason is that superior thoracic artery is the part of, it's a branch from the, it's not taking part actually. Actually the anastomosis is formed between the branches of first part of the subclavian artery and the branches from the third part of axillary artery. So superior thoracic artery or supreme thoracic artery is the branch of first part of axillary artery and it is not taking part in formation of anastomosis. So okay, now also you can give the answer. So yes, so the correct answer is D, and let me explain it. So I will show you a diagram for the proper explanation. So let me just show you the diagram. So here we can appreciate the anastomosis taking place. So what you can see here, the branches of thyrocervical trunk. So thyrocervical trunk is the branch of, thyrocervical trunk is the branch of subclavian artery and it's a branch from first part of subclavian artery. It's the branch from first part of subclavian artery which is anastomosing and the body of the scapula by the circumflex scapular artery. Now circumflex scapular artery is a branch of subscapular artery and subscapular artery is a branch of third part of axillary artery. So see here. Here the anastomosis is formed between, as you can see in the diagram, that is between branch of subscapular artery, that is third part of axillary artery, and the first part of subclavian artery, that is a branch from thyrocervical trunk, and the name of that artery is suprascapular artery. Suprascapular artery. That means suprascapular artery and circumflex scapular artery is maintaining collateral circulation around the scapula body, and also at the acromial process you can see three arteries are there. One branch is coming from suprascapular artery only, the other branch is also coming from thoracoacromial artery, the acromial branch, and one branch from posterior circumflex scapular, this is a branch from third part. So basically we can see two anastomosis is taking place, one at the body and one at the acromial process, and in this category we can appreciate that the artery which is not taking part in formation of this anastomosis is the supreme or superior thoracic artery. We can correctly see. Okay, so here, so the correct answer will be superior thoracic artery, which is not contributing in formation of anastomotic circulation around the scapula. The rest all of the arteries, that is thyrocervical trunk, subscapular artery and suprascapular artery, is taking part in formation of anastomosis. So I think this is clear to you. Sarans Acharya, so yes, is the first MCQ clear to you? Can we move on to the second one? Sarans? Yeah, good evening dear. So yes, this was the first MCQ. I think you have missed out this. So once more I am showing you. So let's move on with the second MCQ. All of the following structure passes through lesser sciatic foramen except. All of the following structures is passing through lesser sciatic foramen except. So option A is pudendal nerve, B is obturator internus muscle, C is internal pudendal vessels, and D is nerve to obturator internus. Nerve to obturator internus. So it's okay Acharya, it's okay. Okay, so just mark the correct answer. Question number second. All of the following structures passes through lesser sciatic foramen except. So yes, I am getting Sharans is telling it's B. Okay, yeah, Sharans is telling it's B. Okay, B. Okay, so yes. So actually obturator internus muscle. So yes, obturator internus muscle is not contributing, it's not taking part, it's not exactly passing through the lesser sciatic foramen. The correct answer would be tendon of obturator internus muscle can pass, but not exactly the obturator internus muscle. So yes, B is absolutely right. Yes, Sarans, you are absolutely right. Yes, Sarans has already given the answer. It's the tendon, not the obturator internus muscle. Yes, Sarans, great explanation dear. Yes, that was the point which I want to tell, but already you have given the answer. Okay, so yes, now I just want to share a good diagram with you. Actually, this will be easy for you to solve the MCQ related to this topic. So please remember this. This is very useful for you. You have to know the structure which is exiting from the greater sciatic foramen. So structure exiting from greater sciatic foramen, the list is given in the green box. So can you see the list in the green box? The green box structure is the structure which is traversing or exiting through the greater sciatic foramen. Okay, this green color foramen is also shown here, as you can see, with a green dotted line. This is the greater sciatic foramen. Okay, and the structures passing through is listed: piriformis muscle, also superior inferior gluteal artery nerves and vessel, nerve to quadratus femoris, and sciatic nerve, posterior cutaneous nerve of thigh. Good evening. Yes, Srija, good evening dear. And now I want to tell you also about the lesser sciatic. So see here, this is the lesser sciatic foramen, and the structure which is exiting through lesser sciatic foramen, that was already given as a answer from Sarans Acharya, that is tendon of obturator internus muscle. Absolutely right, Sarans, you are absolutely right. Okay, and I also want everyone to know this point, that let me just enlarge this boxes. Okay, so all of you have seen the diagram, but I just want that you should also know these important points. So when we are talking about the structure which is exiting greater sciatic foramen and then entering into the lesser sciatic, foramen, these are three structures. We remember it by the mnemonic PIN, pin. We remember it with the mnemonic pin. Pudendal nerve, nerve to obturator internus, and the internal pudendal vessels. Got it? Internal pudendal vessels, pin structure. Everyone, so please by heart this list. This is very important for you to crack the MCQ. So this will be useful for you. Okay, so we have already seen this. Okay, now let's move on to the third MCQ. So can we move on to third MCQ, everyone? Is it okay? This was the second MCQ which we have already solved. Now let's move on to the third one. Most anterior structure on intercondylar area of tibia. Most anterior structure on intercondylar area of tibia. A. Anterior horn of lateral meniscus. B. Anterior horn of medial meniscus. C. Anterior cruciate ligament. D. Ligamentum patellae. So 4 options are there and you have to tell me the most anterior structure in the intercondylar area of tibia. That means the area between the two condyles of the tibia. Yeah. Okay, so please mark the correct answer. So I will give you another 30 seconds for marking the correct answer. There is a good mnemonic also for remembering this. I will share that mnemonic also with you. Okay, so yes. Yes, Shrija is telling it's C, anterior cruciate ligament. What about others? Shrija is telling C. What about others? Okay. So, okay, let me explain the answer now. Let me explain the answer. Anterior structure in the intercondylar area of tibia. Okay, let's anterior structure in the intercondylar area of tibia. So, I would like firstly to show this diagram. Okay, this is the diagram which will help you to understand the structure. Okay, so yes, the correct answer, if we are talking about the answer for this MCQ, if you want to know. So, this is the correct answer is anterior horn of medial meniscus. So, B is the correct answer. Option B is correct. Now, let me show you the diagram which will give you a clear picture about this. So, let me just highlight it. Okay. So, now all of you just concentrate on this intercondylar structure. Most anterior structure here, this is the anterior end of medial meniscus. So, okay. So, if we are moving from anterior to posterior, the structure, the first structure which is lying is the anterior end of medial meniscus. Okay. The second structure is anterior cruciate ligament. So, this is the second structure, anterior cruciate ligament. The third structure is anterior end of lateral meniscus. So, this is the third structure. The fourth structure is the, again we have got the posterior. We have got the posterior end of lateral meniscus. So, where is the lateral meniscus gone? Posterior end. Okay, posterior end of lateral meniscus, this is the fourth structure. Then we have got the posterior end of medial meniscus, and most posteriorly the structure which is lying there is posterior cruciate ligament. Okay, so most posteriorly is the posterior cruciate ligament. So, see here I have marked it 1, 2, 3, 4, 5 and 6, and the structure is also shown there. As you can see here, the structure is also shown there. 1, 2, 3, 4, 5, 6. Okay, and the all structure has been marked along with the area which is located in the intercondylar area. This diagram is very easy for you to understand by seeing this diagram, but I would like to give you a mnemonic also for remembering the structure as we see the structure located in the intercondylar area. So, please write down. This would be very useful for you. Structures located in the intercondylar area of tibia. Structure located in the intercondylar area of tibia. So, from anterior, so what we want to see, the structures located in intercondylar area of tibia from anterior to posterior, So we can remember the structure by a mnemonic that is called as Medial College Lucknow, Medical College. Okay, Medical College Lucknow and Lucknow Medical College. So you can remember it with the mnemonic like this. Please write down Medical College Lucknow, Medical College. Okay, got it? Now we have got 6 structure in the intercondylar area, and I would like to write the list in from anterior to posterior. The first structure is medial meniscus, C for cruciate ligament, C for cruciate ligament, and another L for lateral meniscus. Now these 3 structures are which part? Anterior part. That means anterior horn of medial meniscus, anterior cruciate ligament, and anterior horn of the lateral meniscus, and anterior horn of the lateral meniscus. So these 3 structures, anterior part. Then we will move on to the another L, that is lateral meniscus, another L for the lateral meniscus only. M for medial meniscus, and again we have got C for cruciate ligament. Now you have to just add on the point what? These all structures posterior part. So thereafter we have got posterior horn of lateral meniscus, posterior and of medial meniscus, and posterior cruciate ligament. So got it everyone? Is it okay? Have you understood this relation? A quick revision of the structure lying in the intercondylar area of tibia. Is it okay? This is the relation of structures from anterior to posterior in the intercondylar area. Let's move on to the next MCQ. Can we move on to the next MCQ everyone? Is it okay? Have you understood this? So that is the reason the correct answer for this MCQ will be the B answer, third MCQ. Anterior horn of medial meniscus is the most anterior structure lying in the intercondylar area of tibia. So let's move on to the 4th number MCQ. Yeah. Okay. Guyon's canal contains which of the following nerve? Everyone try to mark it correct. Guyon's canal contains which of the following nerve, whether it is radial, medial, ulnar or anterior interosseous nerve? Question number 4. So yes, Akshit Bhatt is telling it's ulnar nerve. What about others? Guyon's canal contains which of the following nerve? Okay, so yes, yeah, I got Akshit Bhatt. Till now, Akshit Bhatt has given the answer. What about others? Whichever you feel is right, please mark it correct. Okay, Devnath, Shayani, Devnath is telling, Shayani is telling A. It's A. Okay, Guyon's canal contains ulnar nerve. Okay, A. What about others? Yeah. Ulnar nerve, okay, Sarans, ulnar below volar carpal ligament. So he is giving the anatomical location details also. Don't worry, I will explain Guyon's canal boundaries also. Don't worry. Actually, the correct answer is A, ulnar nerve. The correct answer is A. Guyon's canal is containing ulnar nerve and ulnar artery. Okay, ulnar nerve and ulnar artery. So 4th correct answer is A. So let me firstly show you the location of Guyon's canal. So in this diagram, you can see the location of Guyon's canal and you can see the ulnar nerve is passing through it. So what you can appreciate that there is pisiform bone has been shown. Okay, there is pisiform bone which will be lying medially. Okay, laterally there is hook of Hammett, and actually The roof is formed by palmar carpal ligament. Palmaris brevis muscle, we know it's a muscle which is lying on the medial aspect of the palm. It's a muscle in the superficial fascia. So we have to remove that muscle, and then the nerve which we can see is the ulnar nerve. Very nicely we can see the ulnar nerve here. This is the content along with the ulnar artery. So these two structures, ulnar nerve and ulnar artery, these two structures lies in the Guyon's canal. Okay, and its floor is formed by transverse carpal ligament. So you can see here transcarpal ligament is also shown here, which is lying over there. So this is the important location where ulnar nerve can be compressed. Ulnar nerve can be compressed. Okay. Also the part of a thick nerve which is shown here, this is the median nerve which is passing below flexor retiniculum. So let me, so Praveen Sinha is also telling it's ulnar. So let me give you the details of Guyon's canal boundary. So all of you please write down Guyon's canal boundary. So that is important for you to know. Okay. Guyon's canal boundaries. Boundaries of Guyon's canal. So its roof is formed by Raja Kumar. Yes, its roof is formed by palmar carpal ligament, palmaris brevis muscle, and also the connective tissue which is lying in the hypothenar muscle. So hypothenar connective tissues, hypothenar connective tissue, hypothenar connective tissues, these all structures are forming its roof. These all structures are forming the roof of Guyon's canal. The floor is formed by transverse carpal ligament, transverse carpal ligament. Okay, and also the ligaments which is extending from it, extensions, that is pissohamate ligament, pissohamate ligament, and pissometacarpal ligament, pissometacarpal ligament. So all these structures are forming the floor. All these structures are forming the floor. Guyon's canal boundary, the roof is formed by palmar carpal ligament, palmaris brevis and hypothenar connective tissue, and floor is formed by transverse carpal ligament, pissohamate ligament and pissometacarpal ligament. So these are roof and floor structure. Now let me tell you about medial and lateral boundary of Guyon's canal. Written? Now write down medial boundary of Guyon's canal. Medially, which structure lies? The pisiform carpal bone lies along with the muscle of hypothenar eminences, that is abductor digiti minimi muscle, digiti minimi muscle. Also flexor carpi ulnaris, flexor carpi ulnaris muscle. Laterally, which muscle lies? Laterally, Akshay Kumar, thank you dear. Laterally, the hook of hamate is lying, transverse part of transverse carpal ligament, and also the flexor tendons are lying laterally. Flexor tendons are lying laterally. So, and the content we already know, contents we have marked the correct answer also. The contents are ulnar nerve and ulnar artery. The contents are ulnar nerve and ulnar artery. Okay. So these are the boundaries. Thereafter, let's move on to the 5th number MCQ. Is it okay? Can we move on to next MCQ? Okay, so let's move on to the next MCQ, that is 5th number. Yeah. Which knee structures, which knee support structure is most important in stabilization? So most important. So you have to mark it the correct answer A, B, C, whether it is anterior, posterior, cruciate ligaments, whether it is medial and lateral collateral ligaments, fibrous capsule or quadriceps femoris muscle. Okay, Sarans Acharya, yes, everyone please mark the answer what you feel is the right answer. So whether it is the ligaments, the various ligaments which is mentioned, or whether it is quadriceps femoris muscle. So according to you, which is the correct answer? Option A, B, C or D? Option A, B, C or D? Okay. So yes, I am getting Srija, Sarans is telling it's A and Srija is telling it's D. Sarans is telling it's A and Srija is telling it's D. Okay. Okay. So let me see about others. Anyone else wants to answer? Okay, yes, Shyani Devnath is telling it's D. Shyani is telling it's D. Shyani, okay. Yeah. Anyone else? So yes, let me come up with the explanation now. Actually, the correct answer is D, that is quadriceps femoris. The correct answer is D, that is quadriceps femoris. Okay. So why quadriceps femoris? I know that there must be confusion among the students, like anterior and posterior cruciate ligament. As we know, it is very important for maintaining the integrity and antero-posterior stability of the knee joint. We know that it is actually connecting. Okay, it is actually connecting the interior of lower end of femur and upper end of tibia and maintaining antero-posterior stability. Same way on medial and lateral aspect, we have got medial and lateral collateral ligament. And yes, fibrous capsule is one of the strongest ligament, which is also support. It's also a primary ligament of the knee joint giving support. But the correct answer is D, that is quadriceps femoris. Why? I will tell you, because among this quadriceps femoris muscle, which is formed by 4 muscle which is lying on the anterior aspect, vastus lateralis, intermedius, medialis and rectus femoris, is the major support system for the knee joint. It is causing major movements of the knee. It is causing the knee extension and hip flexion. It is causing knee extension, and it is important that the integrity of quadriceps femoris muscle should lie there for maintaining its stabilization. So if the ligaments are injured also, but the muscle is having its full integrity, that is important and it should be restored. So yes, these are the important ligaments which is maintaining the stability of knee joint: cruciate, collateral ligaments and also medial and lateral meniscus. So these are primary ligaments. So what is shown is the primary ligament, but among this, if the primary ligaments are given in the option but also the quadriceps femoris muscle is given in the option, we will go for quadriceps femoris muscle only. Okay, so that is the reason why quadriceps femoris muscle is most important. Among the quadriceps femoris muscle also, vastus medialis and vastus lateralis is most important for maintaining the strength and integrity or stability of knee joint. So you can write that point, that is very important. So please write down. Quadriceps femoris muscle is most important for maintaining knee stability. If you want to know of which muscle most important, VM and VL. What is VM and VL? Vastus medialis and vastus lateralis. So if you want to know of this, which is the most important, so vastus medialis and vastus lateralis is most important. Okay. So let's move on to the next, that is question number 6. So we have got 5 more MCQs to solve. Before that, I would like to give you a general brief about the platform. So let me brief about the platform. So let me tell you about the iconic subscription of Unacademy, where you can get the benefit of joining Prep Ladder. So you get the benefit of Q Bank of Prep Ladder, also the recorded video lectures of the Prep Ladder, along with it live sessions with the top educators of Unacademy platform. So live tests and quizzes are there. You can be the part of live tests and quizzes. You can also cover up your course by rapid revision courses, and structured program is there. Okay, so what happens, special sessions are there which will highly beneficial for you. So you can just take the advantage of that. But the thing is that if you want to prepare for any targeted goal, you have to go in a structured way. Okay, so whole 19 subjects would be covered up along with a systematic way, and all the MCQs will be solved along with a live interaction with the top educators. So all these are given in the plus platform of Unacademy. And the most important point about plus subscription is that every fourth session is a doubt clearing session on the Unacademy platform. So you can avail the opportunity of being the part of these sessions. You can take the PDF notes by taking the subscription of Unacademy, and you can use the code ANAT10 for 10% discount. Okay, so if you take 3 months of subscription, you get 1 month of subscription absolutely free. If you take 12 months of subscription, you get 2 months of subscription absolutely free. This is the code which can be used by you, ANAT10. Download the Unacademy app, use the code ANAT10, and whichever subscription suits you, whether the subscription is of 1 month, 2 months, 2 years, 3 years, whichever, how much time you require for preparation, you can just choose your subscription and take the plus subscription of Unacademy. So after taking the plus subscription, you are being the part of live sessions, you are being the part of weekly tests, you can have the unlimited access to all video lectures and live sessions. Structured courses are there for targeting your goal. So what are the sessions which is going on the Unacademy platform? NEET PG session batch is going on, so you can join this. Marathon batch for MCQ FMGE course is going on, and ANAT10 is the code that can be used by you. INICT MCQ marathon batch, and also next. So those students who are targeting next 2022 or 23, also they can just join this session. This will be extremely beneficial for you. So yes, can we move on to the 6th MCQ? Everyone, is it fine? Let's move on to the 6th number MCQ. Okay. So yes, which nerve supplies no branches? Which nerve supply no branches to arm? Means not innervating any muscles in the arm. Which group of the muscles? Options, so A, B, C or D, whether it is musculocutaneous and median, radial ulnar, median ulnar, or median and radial. According to you, which is the correct answer? Which pair is not giving any innervation to the arm muscle? Any innervation to arm muscle? So mark your answer, question number 6. So Sarans is telling it's C, Shrija is telling it's C. What about others? Sarans and Shrija both are telling C as the correct answer. Okay, so let me tell you the correct answer. Which nerve supplies no branches to the arm? The correct answer is also C, my dear friend. So yes, absolutely, Sarans and Srija, you are right. Actually, both median nerve and ulnar nerve is not supplying any muscle in the arm. Median nerve is supplying most of the muscles of forearm, flexor group of forearm. Yes, Akshit Bhatt, C is right. So it is giving innervation to most of the flexor muscles of the forearm, except flexor carpi ulnaris and that of the medial half of flexor digitorum profundus. When we talk about ulnar nerve, it is supplying most of the intrinsic muscles of the hand, except that which is supplied by the medial nerve, that is thenar muscles and the first and second lumbricals muscles. But when we see the radial nerve and that of musculocutaneous nerve, so here musculocutaneous nerve is supplying all the arm muscle. So it is supplying all the anterior arm muscle. It is supplying anterior arm muscle, and radial nerve is supplying the triceps muscle in the arm. Okay. So yes, the correct answer will be median and ulnar nerve not giving any innervation. So let me just write here itself. So yes, we have got C as the correct answer, and musculocutaneous nerve is supplying three muscles in the arm, brachialis muscle, it is supplying brachialis muscle, it is supplying biceps brachii muscle, it is supplying coracobrachialis muscle, it is supplying coracobrachialis muscle. Got it? When we talk about radial nerve is supplying triceps muscle. Radial nerve is supplying triceps muscle in the arm. Got it? But not a single muscle is getting innervation from ulnar and that of median nerve. Why? Because ulnar nerve is basically supplying most of the muscles of hand, intrinsic muscles of the hand, except thenar muscles and first and second lumbricals, and medial nerve is supplying all the muscles of the forearm flexor group of muscle except medial half of flexor digitorum profundus and that of flexor carpi ulnaris. So, is it okay? Should I write or is it okay? I have written the important point. So, can we move on to the next MCQ, MCQ number 7th? Everyone? Okay, so let's move on to the 7th number MCQ. Yeah. Which of the following muscle flex arm at glenohumeral joint? Which of the following muscle is flexing the arm at glenohumeral joint? Okay, yes. So, please mark the correct answer, question number 7. Shrija, okay. Sarans Acharya, it's B, okay. What about others? Pectoralis major. Sarans Acharya is telling pectoralis major, okay. So, yes, 4 options are there and I will write the action of each of the muscle. So, B, 7th B who is telling, okay, many of you are telling B. So, yes, B is absolutely correct. Yes, all of you are absolutely right. B is the correct answer. So, let me just write the action of the muscles which is provided here. So, let me just give the details. Okay. So, the muscles which were listed here, one of the muscle was pectoralis major muscle. So, yes, all of you are right, pectoralis major muscle is causing flexion of shoulder joint. Actually, which part of pectoralis major muscle? Clavicular part of, which part? Clavicular part of pectoralis major muscle. Yes, Monica Sharma, you are right, clavicular part of pectoralis major muscle is causing flexion of arm. Which part? Clavicular part. Okay. So, this was the option. So, it was the correct answer. What about the other options which was given? One of the option was deltoid. But in the deltoid, they have written posterior. I think posterior fibers they have written. Okay. Deltoid posterior part. So, that is not correct. Actually, anterior part of deltoid muscle, not the posterior, but anterior part of deltoid muscle is causing flexion of arm. The other two muscle was latissimus dorsi. The other muscle was latissimus dorsi, and so latissimus dorsi is causing adduction of arm. It is causing adduction. It is causing adduction, extension, and internal rotation of arm. So, it can't be the correct answer. It is not causing flexion. It is causing extension of arm. So, that is the reason it is not correct. One more option was subscapularis. Subscapularis. So, subscapularis can't be the correct answer because it is causing, subscapularis muscle is causing internal rotation and adduction of arm. Adduction of arm. So, yes, this is the reason it can't be the correct answer. So, is it okay everyone? Yes, Sarans, you are absolutely right. Yes, Monica Sharma, absolutely right. Absolutely right. Yes, extension by posterior part of deltoid. Yes, absolutely right. Middle part of deltoid is acromial fibers, and that is middle fibers or the acromial fibers of deltoid is causing abduction, 15 to 90 degree of abduction. So yes, all of you are perfectly correct. So now can we move on to the next MCQ, MCQ number 8th? Okay, so let's move on to the 8th number MCQ. So yes, great performance. Now let's mark the correct answer for the 8th number MCQ, and those who are interested for more MCQ session, I will just cover up the session in another 10 minutes. I will over it 10-15 minutes, and then from 9 p.m. you can join me on the Unacademy special session and class, and at 10 is the code. So you can join me for the special classes, and you can get the link on the Unacademy group Let's Crack NEET PG and my own group Monalisa Anatomy. This is the Telegram group of mine. So you just join the Monalisa Anatomy group where you will get the link of my special session. So 9 p.m. again, this is the session of just half an hour, and 10 MCQs more of anatomy I am discussing. So you can join me there also at 9 p.m. So mark the correct answer, question number 8. All are branches of femoral nerve except. So Srija is telling it's B. Srija is telling it's B, lateral cutaneous nerve of thigh. Okay, Srija. What about others? Sarans Acharya is telling it's B. Okay, Sarans and Srija. Okay, Srija, lateral cutaneous nerve of thigh is direct branch from lumbar plexus. Very good. So yes, Srija has given a very nice explanation also. She has given or explained the answer also. Yes, the correct answer is B. The correct answer is B. Lateral cutaneous nerve of thigh is a direct branch from lumbar plexus. Absolutely right. So yeah, Monica, C, no dear, it's a branch from femoral nerve. It's a branch from femoral nerve. Nerve to sartorius is also branch, and saphenous nerve is also branch. Don't worry, I will show you that diagram also. Sarans, it's lateral cutaneous direct branch. Lateral cutaneous nerve is a branch of lumbar plexus. So can anybody tell me the root value of lateral cutaneous nerve? Can anybody give me the root value of lateral cutaneous nerve? Root value of lateral cutaneous nerve. Root value of lateral cutaneous nerve. Okay, so let me just tell you about the lateral cutaneous nerve. L2 and L3, who is this? Bhatt, Akshit Bhatt is absolutely right. He is absolutely right. Yes, Sarans is also right. Lateral cutaneous nerve of thigh, which is also called as cutaneous nerve of thigh. It's actually a branch from, yeah, what a perfect answer given. Dorsal division, ma'am. Absolutely right. Perfect. Srija, perfect answer. It's the dorsal division. It's from the dorsal division, dorsal division of L2 and L3. Dorsal division ventral rami of L2 and L3. Okay. L2 and L3, absolutely right. And it's a direct branch from lumbar plexus. It's a direct branch of lumbar plexus. It's a direct branch of lumbar plexus. Absolutely right. Absolutely right, dear. Absolutely right, Srija. And if you want to see the branches of femoral nerve, see this flow chart. So yes, femoral nerve root value L2, L3 and L4. Dorsal division, again femoral nerve is from dorsal division ventral rami. So it is, what is the root value femoral nerve? It's from the dorsal division ventral rami of L2, L3 and L4. Got it? Its anterior part, anterior division of femoral nerve is giving branch to sartorius muscle and to cutaneous nerve, intermediate and medial cutaneous nerve of thigh. Okay, it is giving two branches, intermediate and medial cutaneous nerve of thigh. In the thigh region only, the posterior division, yes dear, yes. Adarsh, yes dear, yes. So I also remember one of my student when I was doing PG there was named as others. Okay. Yes, dear. So yes, the rectus femoris, vastus medialis, vastus lateralis. So all of the quadriceps femoris muscle is again getting innervation from posterior division. Also give innervation to knee joint, hip joint, and the saphenous nerve. If the saphenous nerve is again a branch from posterior division of femoral nerve. Okay, saphenous nerve is a branch from posterior division. So is it clear? Okay. So let's move on to the next MCQ, that is MCQ number 9. So are you ready for the next MCQ, MCQ number 9, everyone? Question number. Okay, so others, ma'am, I am NEET UG aspirants. Okay, so well prepared for your examination, dear. All the best, all the best. All the best, others, all the best, dear. Stave cells are seen in liver, spleen, pancreas and gallbladder. Which is the right answer? Stave cells are seen in liver, spleen, pancreas or gallbladder. So Srija is telling it's B. What about others? Stave cells. Okay, waiting for others. Whether it is A, B, C and D. So Srija has given the right answer. So yes, the correct answer is spleen. So Srija, you have given absolutely right answer. The correct answer is spleen. Yes, spleen is the correct answer. Banana leaf cells of spleen. Okay, I would like to, yes, spleen is the correct answer for stave cells, and I would like to tell it's like spindle shape is more correct. I think spindle shape, or you can say the shape is like a barrel. The shape is like a barrel. So barrel, the shape is like a barrel. Okay, okay, barrel. So the correct answer is barrel. Okay, so actually it's a barrel shape and spindle shape. Okay, that is important. Okay, so now stave cells is the correct answer. So yes, we have to now okay, others, now I am taking session. You can join my Telegram group for the updates and for your queries. Okay, others, now I am taking, and all the students are preparing for NEET PG. So you can ask me your doubts in my own Telegram group, that is Monalisa Anatomy. Okay, my own Telegram group is Monalisa Anatomy. So stave cells are barrel shape or spindle shape, and the shape is like this. I have included this diagram. So please see this. Okay, so here what you can see, this shape is barrel shape. Actually the name which has given in many of the books, it is written. So you can see that it is a wooden casket. You must be knowing that we have got wooden casket is used for fermentation of wines and beers and all. So exactly that shape is the stave cells. Okay, actually here what happens, the splenic venous sinusoids is having a shape of spindle, and it is having microphases inside. It is having plasma cells, and it is also having a covering. Can you see, it is surrounded by these fibers. What are these fibers? These fibers are reticular fibers. So this whole arrangement is giving it is a shape, barrel shaped, and this structure is named as stave cells, which is seen in the slide of. So we can see a good clear stave cells when we see the electron microscopy or high power view of spleen. Okay, so this is the stave cells. Got it, everyone? Stave cells. Got it, dear? So this is one of the characteristic feature which is seen in the spleen. This is required for engulfing the worn out RBCs. Okay, let's move on to the next MCQ. So can we move on to the next MCQ, everyone? Okay. Now, Buccopharyngeal membrane is consist of. So give me the answer. Buccopharyngeal membrane is consist of which two layer, whether it is mesoderm and ectoderm, whether it is ectoderm and endoderm, whether it is ecto, meso or endo, whether it is endo or mesoderm. So what is the correct answer for this? Buccopharyngeal membrane is consist of which 2 or 3 layers? Shrija, Sarans, yes. Question number 10th. Ecto and endoderm, Sarans is telling. Okay. Okay. So yeah. So ecto and endo. So yes, you are telling B. Okay. So B. Ecto and endo. Okay. So which two membrane, can you name me, can you tell me the name of one more membrane which is also made of ecto and endoderm? These two membrane always asked in the MCQ. So one is buccopharyngeal membrane, absolutely right, B is the correct answer. So can anybody tell me, Shrija, you are also right. One more membrane is there where there is no intermediate mesoderm lying in between ecto and endo. So two areas are there when the embryological development is going on, where we have got just ecto and endo. One is the buccopharyngeal membrane, other is, what is the name of other membrane? Cloacal membrane, yes, absolutely right dear. So Sarans Acharya is given absolutely right answer. Yes, buccopharyngeal membrane and cloacal membrane. This is the two areas where we have got just ecto and endoderm, no intervening mesoderms. Okay, so yes, absolutely right dear. So see here we can see this is the buccopharyngeal membrane and this is the cloacal membrane. Okay, these are the two structures where it is consist of only two layers. One is the ectoderm and the other is endoderm, no mesoderm. Okay, absolutely right Sarans Acharya and absolutely right Shrija, absolutely right dear. So yes, we have covered up the 10 MCQs, but before ending, so I would like to tell Sarans Acharya, Shrija, very nice performance, and always and all of you, Akshit Bhatt, those who are always being there, so good performance. So you can join me for the 9 PM session on the Unacademy special session, where again I will discuss 10 more MCQs and half an hour session only. So I would like to tell you, so you can be the part of my live session. This is absolutely free dear. So you can join with using the code ANAT10. If you are using the Unacademy platform for the first time, then you have to use this code. Otherwise, and 9 PM is the timing. So you can join my Telegram group. So this is the link of, I will come to that. So this is the link of my group. So this is the Telegram group link, Monalisa Anatomy. So you can join my group. Thank you Shrija. So you can join this Monalisa Anatomy. This is the Telegram group where the link of my sessions will be provided. So today is 6th and I am taking 4th part of my High Yield Anatomy MCQ session there also. So every day 20 MCQs if we are going to solve. So surely it will help you. Okay. And also I want to tell that about my session. So morning 11:30 AM is the timing of YouTube session of conceptual anatomy topics. 7:30 is again the anatomy MCQ discussion time. 9 PM is anatomy MCQ discussion time on the Unacademy platform, and 6 PM is the time for conceptual anatomy. So yes, these are the details, and more and those who want to take the plus subscription can use this code ANAT10. So yes, all of you can join me for yeah, Vishnu, thank you. It's okay if you are late also, nothing to worry. You can just see the session once more time at your time, nothing to worry. You can join. All who are interested for solving more anatomy MCQs can join the session 9 PM, and also they can join my group Monalisa Anatomy for the updates of upcoming sessions and my free live session. Thank you so much. All the best. Thank you, dear.